Here's a question worth sitting with. When your nurses, care coordinators, and clinical staff show up to work, what percentage of their day is actually spent on patient care versus administrative work? For most home healthcare providers, the honest answer is uncomfortable. Skilled, credentialed clinical professionals spending hours on scheduling, documentation, insurance paperwork, phone follow ups, and compliance tracking. Work that matters, but work that doesn't require their level of training to do. And every hour a nurse spends on administrative tasks is an hour not spent at a patient's side. I'm Jeff, CRO and co founder of ClearDesk. Today, I want to walk you through how remote administrative assistants change this dynamic in home healthcare, what they handle, what that frees up, and why it matters for both the quality of care you deliver and the financial health of your practice. Let's be specific about what's actually on a home healthcare administrator's plate because it's more than most people outside the industry realize. Patient scheduling and appointment management is a full-time function in any active practice. Coordinating care visits, managing provider calendars, handling rescheduling when patients cancel or conditions change, sending appointment reminders to reduce no-shows, and coordinating transitions between multiple healthcare professionals involved in a single patient's care. This is complex, detail intensive work that never stops. Patient communication and follow up is another major area. Phone calls and emails from patients and families need to be answered professionally and promptly. Follow up after visits to gather feedback, address questions, and confirm that patients have what they need for self care. Coordinating ancillary services such as delivering equipment delivery, lab tests, transportation. Each of these touch points affects how patients experience your care and whether they trust you with their ongoing health. And then there's documentation and compliance. Home healthcare providers operate under strict regulatory requirements from agencies like the Centers for Medicare and Medicaid Services. Patient assessments, treatment plans, progress notes, billing records, all of it needs to be accurately documented, properly organized, and readily accessible. The consequences of gaps aren't just administrative, they affect reimbursement, audits, and the continuity of patient care. When clinical staff are absorbing all of this alongside their actual care responsibilities, something has to give. Usually it's the quality and consistency of the administrative work itself, which creates downstream problems that are expensive to fix. A remote administrative assistant changes the structure of how this work gets done. They handle the scheduling function end to end, including building provider calendars, managing appointment logistics, coordinating with patients and families, and handling changes without pulling your clinical team into the back and forth. Your care coordinators and nurses know their schedules are organized and their patients are informed without having to manage that process themselves. They own patient communication, fielding calls and emails, providing follow up after visits, distributing patient education materials, and coordinating the ancillary services patients need between appointments. The response is faster, the communication is consistent, and patients feel attended to rather than waiting on a callback from a clinical staff member who's already running behind. And they support documentation and compliance tasks, managing patient records, tracking regulatory deadlines, handling insurance and billing coordination, and maintaining the organized paper trail that keeps your practice in good standing. This is work that has to happen correctly and on a consistent schedule. A dedicated remote assistant makes sure it does. Now let's talk about what this costs and what it saves. The overhead associated with in-house administrative staff, office space, equipment, payroll taxes, benefits makes building out a full administrative team expensive for any home healthcare practice and particularly difficult for smaller or growing ones. Remote administrative assistants eliminate most of that overhead. You access skilled professionals at a significantly lower cost than local hires, with the flexibility to scale support up when patient volume grows and adjust when it doesn't. Beyond the direct cost savings, there's the productivity equation. When your clinical staff spend more of their time on clinical work and less on administrative tasks, patient throughput improves, care quality improves, staff satisfaction improves, because the people you hired for their clinical expertise are actually using it. That combination of lower administrative cost and higher clinical productivity is where the real return on this model shows up. Here's what I want you to take away. The administrative work in home healthcare isn't optional. Scheduling, patient communication, documentation, compliance, all of it has to happen and it has to happen correctly. The question is who does it? When it lands on clinical staff, you're paying a clinical rate for administrative work and reducing the hours available for actual patient care. When it belongs to a dedicated remote administrative assistant, the work gets done by someone whose entire focus is doing it well at a cost that makes the practice more financially sustainable. At ClearDesk, every remote team member we place goes through our talent assurance protocol with a 0.5% acceptance rate. We pre screen for the skills, professionalism, and reliability that home healthcare demands. And we support the onboarding process so your assistant is integrated and productive from day one. Um, if your practice is ready to give your clinical team their time back, book a call with us. Link is in the description.